Anatomy 32, Chapter 11, the Muscular System. Topics: muscles that move the torso. So, starting with muscles that move the vertebral column, here we have the three scalenes: anterior scalene, middle scalene, and posterior scalene, which is a little hard to see. It's hidden a bit under the levator scapulae muscle. So again, anterior scalene, middle scalene, and posterior scalene. All of them have their uh, insertion in the ribs 1 and 2. So the scalenes, all of them, elevate the first and second ribs during deep inhalations when you try to breathe in as deep as possible. However, they also have a reverse muscle action, so they can flip their origin and insertion. And so now their insertion is in the cervical vertebrae, and they can help to laterally flex the neck, which allows you to rest your head on your shoulder. Then we have a lot of muscles that run along the back, but we're going to focus on the largest of these muscles. This includes the most lateral, the iliocostalis thoracis that inserts into the ribs. We have sort of in the middle, semispinalis thoracis, which inserts into the vertebrae's transverse processes. And then we have straight down the middle, the spinalis thoracis, which are inserting into the spinous processes of the vertebrae. So again, they sort of go out to in, or whichever way you prefer. So furthest out, most laterally, iliocostalis thoracis. Uh, More medially is the semispinalis thoracis, and the most medial is the spinalis thoracis running along the spinous processes. And all of these muscles have very similar action in that when they act together, when both the right and left sides are acting together, they extend the vertebral column. They take you from, say, a bowed position to standing straight up, or even hyper-extending backwards. So all three of them extend the vertebral column when acting together. Uh, for iliocostalis thoracis, if it acts singly, it can also laterally flex the vertebral column, allowing you to bend to the right or left side. And for the semispinalis thoracis, if the muscles act singly, it can help you to rotate the vertebral column, to twist to the right or left. Also, lower down is iliocostalis laborum. Iliocostalis laborum looks to be somewhat continuous with iliocostalis thoracicus. So just one's up here and one's down here is basically the way to tell them apart. Together, this muscle helps to extend the vertebral column, and singly, it can help to laterally flex the vertebral column, again letting you bend over to the right or left side. And here's just a view of these muscles on a cadaver, iliocostalis laborum, which then leads to iliocostalis thoracis. Here is semispinalis thoracis, and then right down the middle is, of course, spinalis thoracis. And you can even see up here splenius capitis and semispinalis capitis. All right, the diaphragm. Diaphragm is a very important muscle for breathing. It is sort of a bowl-shaped muscle, as you can see here. It is the separator between the thoracic cavity and the abdominal pelvic cavity. When it contracts, it flattens out, pulling down, and this happens during inspiration when we breathe in. And this will then stretch the lungs, increasing the volume of the lungs, which allows air to flow into the lungs. And as a consequence of this pulling down and flattening out, it also increases pressure on the abdominal pelvic cavity, on the structures in the abdominal pelvic cavity. Its origin is huge. Again, it is going all the way around the body. So its origin includes ribs 7 through 12, xiphoid process of the sternum, the costal cartilage, lumbar vertebrae. So it's just a big ring going all the way around. Its insertion point is part of the diaphragm itself. It is the central tendon. So the diaphragm inserts into itself. All right, we also have these muscles between the ribs, the external intercostal muscles and the internal intercostal muscles. The external intercostal muscles have their origin on the inferior border of the superior rib, and they insert into the superior border of the inferior rib. So origin in the superior rib, insertion into the inferior rib, and when they contract, it helps to elevate the ribs during quiet and forced breathing. So they help to bring up and stretch out the thoracic cage, the ribs. So they are pulling up the ribs, important during breathing. The internal intercostals are arranged in the exact opposite arrangement. So their origin is the superior border of the inferior rib, and their insertion is in the inferior border of the superior rib. So again, origin is the inferior rib, inserts into the superior rib, so that when they contract, they actually depress the ribs, so pull the ribs down. And this is important during forced expiration. So when you try to exhale really quickly, when you are perhaps singing or yelling. All right, then we get to the abdominal wall. We have anteriorly the rectus abdominis muscles, a right and left rectus abdominis muscles, these thin, long muscles, going from its origin in the pubis to its insertion in the xiphoid process in ribs 5 through 7. And then we also have the external obliques on the lateral sides. The external obliques origin is in ribs 5 through 12. It inserts into the linea alba and the iliac crest. And their actions, rectus abdominis, when it contracts, it helps to flex the vertebral column, so to help allow you bend forward, bend anteriorly, or bow. And it also can compress the abdomen, put pressure on the abdomen. The external oblique, when both obliques are contracting, it can help to compress the abdomen or help to flex the vertebral column, help us to bend, bow forward. And singularly, if only one of them is contracting, it can laterally flex the vertebral column, allowing you to bend over to the right or left side, or it can help to rotate or twist the vertebral column. Now, I think it's worth here to point out a few things. There's a lot of connective tissue in this abdominal area. This includes what's called the linea alba. The linea alba is this fusion of connective tissue structures that run down the midline. Then there are the aponeuroses of the external oblique and the that stretches out to the linea alba. So this is connective tissue structure going from the external oblique and inserting into the linea alba. There are other rectus sheaths that are aponeuroses, are connective sheets of connective tissue that surround the external and internal obliques, as well as the transverse abdominis muscle. So all of these sheets of connective tissue end up connecting to the linea alba. At the very edge of all this connective tissue structure is what's called the inguinal ligament, which includes the inguinal canal. And finally, when you look at the rectus abdominis muscles, you see these thin bands of connective tissue going across the muscles. These are called the tendinous intersections, and they basically sort of break this muscle up into units that when someone does a lot of sit-ups or whatever and really works out hard, they get the six-pack look. So this is one muscle, but it has these sheets of connective tissue that make it seem like it's broken up into multiple muscles. All right, then we have the internal oblique. The internal oblique is deep to the external oblique. Its origin is the inguinal ligament down there, as well as the iliac crest, and it inserts into the linea alba, as well as the pubic crest, ribs 9 through 12, and the costal cartilage. It has a rather large insertion. And then we have the transverse abdominis. Transverse abdominis is deep to the internal oblique, and its origin is the iliac crest, the costal cartilage, and the inguinal ligament. It's a pretty large origin, and it inserts into the linea alba and the pubic crest. So, as you can see, these are three layers of muscles with their fascicles oriented somewhat differently. The internal oblique, when it contracts, when both of them contract together, helps to compress the abdomen as well as flex the vertebral column. Singly, the internal oblique by itself can help to laterally flex the torso or rotate the vertebral column, twist the vertebral column. The transverse abdominis, when it acts together, can help to flex the vertebral column and compress the abdomen. And when it acts singly, it can help to laterally flex the vertebral column. So here's just another view of some of these muscles. Here's the diaphragm. Here's the external and internal intercostal muscles lying between the ribs. Again, here is the linea alba running down the midline, a fusion of the connective tissue structures coming off of the external oblique, internal oblique, and transverse abdominis. Here is the very deep transverse abdominis. Superficial to that is the external oblique, and then superficial to that is the external oblique. And then, of course, here is the transverse rectus abdominis. Rectus abdominis. A hernia. A hernia is when the small intestine is able to push through an opening or rupture in the abdominal wall. This can occur at a place where there's already an opening, such as in the inguinal canal. So the small intestine can push through the inguinal canal, leading to a lump. It also can squish out under the inguinal ligament for a femoral hernia, or it can emerge from a rupture, a tear in the abdominal wall, in the case of, say, an epigastric hernia or an umbilical hernia. Hernias are important to treat because as the small intestine starts to protrude through, more of it can start to push through, and it can twist, killing off part of the small intestine, which would be very bad. So if you see that you have a hernia, you should go see a doctor. Don't need to rush to the emergency room per se. You just need to see a doctor relatively soon. And what they will do is they will perform a surgery to close the tear in the muscle tissue and add a mesh to cover that area or cover the opening in the case of an inguinal canal to then prevent the intestine from pushing through again in the future. That is it for this part of Chapter 11.